So gait pattern we take observed in cerebral palsy mostly they are because of the spasticity and the topographical type of involvement, and they are best seen when there is a unilateral involvement instead of the bilateral involvement. When you compare a hemiplegia with a diplegic patient, you basically understand what type of gait the patient is. Then there is spastic gait. There are four patterns are spastic gait. One is simple hemiplegia. In hemiplegia, that is the foot drop, only equinus deformity. Then type 2 gait, that is called true equinus with or recurvator deformity. And here is the simple equinus gait here and on the epi and lateral both side, but there is an extended knee and extended hip joint, little bit flexion at the hip joints. So if sometimes in the post-operative, as I told you initially, if you do the TAL, he may develop like a step gait pattern, either flex hip, extended knee, and the normal ankle joint that is called the stiff knee gait. In stiff knee gait, it is because of the body temperature. So here you find a normal equinus and flex hip or without flexion of the hip joint. That may be a compensatory. Hip flexion may be a compensatory. Then type 4 gait is the jump and is very important gait. And if the patient is a scissor, if he is no scissor, the jump simple is very easy to manage. And if you see this is flexion of the hip joint, flexion of the knee joint, and significant equinus. When you go for the swimming, you at least you do the jump. Finally, you will see here also. Then you will realize what is the jump gait. Then there is a spastic diplegia. This also has a 4 type of gait. One is the true equinus, then jump, then apparent equinus, and the crouch gait. I will describe this in the next slide. So here is the group 1 true equinus gait. Here is the normal or extended hip joint. Knee is also extended, but there is a equinus contracture which is more than plantigrade, more than 90 degree, 130, 110 degree, or minus 30 degree. There is simple equinus. So this is the true equinus gait. And if there is a further decompensation, then it develops a jump gait. Here you will find a flex knee, flex hip, maybe extended hip as well, but mostly it is the flex hip. Before jump, you adopt this posture, and there is an equinus, and then there is an equinus which more is minus 30 degree equinus. Further is the apparent equinus, we usually call it the dynamic equinus gait. Here it is same as in a jump gait, but it is 90 degree. But when he runs, then he develops the equinus. But when he stand easy with 90 degree, with little bit of flexion and sometimes no flexion at the knee joint. And then is very worst type of gait, which may be post-operative, which may be because of the decompensation of the growth spurt or because of the weight he is gaining. Here it is same as the extended knee or extended hip or flex hip, flexed knee, and dorsiflex ankle. Initially, in equinus gait, what they develop a rocker bottom foot. There is a contracture of the ankle joint, but they develop a rocker bottom foot like this because of the decompensation of the weight. But if you carefully examine, they have the equinus deformity, and later with further disability or further weight gain, the triceps become weak, or sometimes we do the TAL and they goes to develop the more dorsiflation, which is called crouch gait, and it is the gait which is difficult to begin. So here is certain example of the true equinus gait. Here you have little flexion at the hip, extended knee, and the plantar flexed ankle joint. That is called the gait. And if you find a diplegia jump gait, you will find here like this: flex hip little bit, flex knee, and the plantar flexed or the equinus ankle. This is exactly a gait before you jump on it. And crouch gait sometimes is like that. When something is falling from upstairs and you are going to catch this, then you dorsiflex your ankle. That is called the crouch gait. So here is the crouch gait. This is the position of the crouch. And if you do your head level, you will feel that this crouch gait is just to crouch. You to grasp something while it is falling. That is called the crouch gait. Here there is a bilateral flexion of the hip joint, knee is also flat and ankle is dorsiflex. This is the worst gait to manage. So here is the apparent equinus. Here, when the child stands, he can stand easily with the dorsiflex, normal 90-degree angle. Here is a 90-degree angle. But when he starts walking or running, then he develops a dynamic type of equinus, apparent equinus.